From Gallenbeck Plastic Surgery, this is New Techniques in Cosmetic Surgery.
If you just tuned in, we've been discussing breast augments, breast lifts, and also breast reductions. Now we're going to shift our focus to other aspects of the body, liposuction, how that can help recontour the hips, the thighs, and other areas. Dr. Gallenbeck, certainly liposuction and the type of liposuction that you use can make a significant difference in the shape of a person's body, but also in the recovery time.
Right. Well, with liposuction, the real advantage of liposuction is it removes fat cells.
Okay.
Permanently removes fat cells. So not only do we make somebody smaller, but we improve their shape. Whereas diet and exercise, the fat cells will shrink and the bulges may get smaller, but the bulges don't go away. Now certainly I tell everybody, diet, eating right, exercising goes hand in hand with liposuction. If you get liposuction and then you start eating fast food and you don't exercise, you're gonna get fat. But people say, I'm frustrated because I'm doing everything right. I have a personal trainer. Some of the people that come in for liposuction are personal trainers. I'm doing everything right and I can't get rid of these bulges. And that's what liposuction is for, to target those areas, remove the extra fat, and improve their shape. Okay. But folks say, look, I want to get something done. I don't have a lot of time to recover. And really, I think that this is one of the things that has really opened up and allowed more people to get liposuction because they can fit into their schedule. I mean, you can get liposuction in the abdomen on a Friday or Saturday and be back to work Monday. You're a little sore, like you've worked out too hard, but they say, I've done that before. Medically, there are no restrictions, and you're up and around a lot sooner, and people can really fit into their schedule now. You can really do any area of the body, tummies, hips, thighs, back, arms, neck, chest. It really doesn't. Anywhere there's fat, you can get rid of. You can get rid of it.
Well, you mentioned it could fit into your schedule. Well, you also fit into your clothes a lot better if you pursue this type of technique. And the abdomen, of course, is the one place I think men and women probably complain about a lot because it tends to be right where everything goes.
Right, right. And
so that's certainly one of the areas I imagine that's pretty often requested.
Yeah, and the abdomen, especially in women, the lower abdomen, they always come in, I've got this little pooch, I can't get rid of it. And when I look at the abdomen, I usually do not only the lower abdomen, but I'll contour the upper abdomen and the sides to bring everything so that it flows and blends nicely. And here's a woman that we did liposuction of the abdomen on. You can see in her before picture she's got an extra bulge, mainly in her lower abdomen, but also in the upper abdomen and in the sides. And by performing the liposuction, not only do we give her a better waistline, we're also getting rid of the extra fat in her abdomen so that she's flatter and tighter. And you can see in her after pictures just that. In the front view, you can see she's got a better waistline. In the side view, you can see that her abdomen is much flatter. The liposuction incisions are about 1/8 of an inch, 1/4 of an inch long. They're in the panty line, so they're well hidden. And you can get a result like this and be up and around in no time.
So it takes about how long for this to be performed?
Liposuction of the abdomen is about 45 minutes. We use intravenous sedation so the patient's having a nice little snooze. So for them, it's just like that. And they're recovering for about an hour at our facility. Then they can go home and they're up and about immediately.
Okay. And maybe a little soreness, but that, of course, also will abate.
Right.
Okay, terrific. And, I did say something about men a little bit earlier. And yes, if you are a male and you're watching this show right now, certainly there's liposuction for you. And there are certain areas of the body that men certainly complain about, and that would probably be something called, what, the love handles?
Yeah, the love handles in the abdomen. And men also, same thing. They say, look, I'm at the gym all the time, I work out, I can't get rid of this stuff. And they come in for liposuction. Again, small incisions, remove the fat, improve the shape. And here's a gentleman that we did liposuction on. You can see in his before picture, the front of his abdomen, he's got excess fat, not a lot of definition. On his back picture, you can really see the love handles.
Right.
They're big, they're there, he can't get rid of them. And in his after pictures, you can see that his abdomen is much flatter and his love handles are gone. And this is the kind of result that you can get with liposuction. He's out of the garment in 4 days, back to work, social activities in no time. Well-hidden incisions, and in men, again, I do the incisions below the belt line. So in shorts and bathing suits, you won't see any of the incisions.
Okay, and those too fade with time.
Right.
Okay, good stuff. And so, gentlemen, if you're out there looking at this, know something can be done. So thanks so much for joining us. This has been New Techniques in Cosmetic Surgery. I'm your host, Jan Callahan, along with board-certified plastic surgeon Dr. Matthew Gallenbeck. We'll see you next time.